main idea is to produce IPs and so on. Even we have our colleague from Faculty of Computer Science who, utilizing artificial intelligence, whether it can take selfies, whether not that selfies can be used to so-called screen COVID-19 patients. So this is very, very interesting. But to say, yes, there is a lot of grants available, but we are trying our best to acquire it at the moment.
Can I get Prof. Saiful, the other part of Malaysia, you should have some different experience, to get people to apply for this international grant. Do you have anything to share with us?
Yes, of course. We have to encourage our staff, our lecturers, to actually apply for the international grants. And just a few days ago, I received that we received about 100,000 ringgit grant from One Health University Network. And I'm sure we need to actually get more international grants. So basically, basically we have to try to bid and get the grants. Yeah.
Anything, Prof. Effendi, you want to share about your experience in asking people to apply grant for national or international related with COVID?
Thank you, Prof. Nafiza. I think opportunity to grab either national or international grant, we must not ignore that. It's very important for the research group or individual who have a great personal track record in research. Again, it depends on the capability of the research group or researcher. It depends on resources that you have. I think we all know the strength, weakness, opportunity, threat we have in each faculty, and which particular individuals of research group that we actually should push them to go for this big gun of the international grant. So if I want to put the axis in terms of publications versus grant, those on the top right corner who has secured many grants in the past, who are very prolific researchers, who have published or output a lot. So perhaps these are the groups that I must identify to go about or to try for the international grant. And it is not solely focused on the virus itself, because the sequelae or the implication during COVID, for example, affecting NCDs, how the patient did not manage to go for review in the clinic, how's this diabetes poorly control and personal loss of job. And I think the implication, the complication of the COVID, NCDs, mental health, psychosocials, and I think that is stuff without the grant, using knowledge, attitude, practice, can produce a lot of output for the individual or to the individual or the research group. So to summarize, yes, any international grant or national grant we should grab. Early motivation, early planning. For example, we know that regular FRGS, TRGS would be in February or January every year. So we must focus on the particular lecturers who are in the particular group, research interest, to come up with the early research proposal. Then by end of the year, we just fine tune and click by January, February for formal submission. I think we should encourage this spirit in the university. That's my comment. Thank you.
Thank you, Prof. Effendi. Anything from Prof. Dato Adiba? You want to share your experience in asking people to apply for international grant in UM?
Yeah, so there is, I think we've taken the same approach as Prof. Shah at Monash. We haven't really kind of taken any big proactive approach, because the virologists in our medical microbiology, and to a certain extent the parasitologists, are capable of taking on COVID research. So I have really, Prof. CJ and I have really entrusted our colleagues that they know what to do whenever an international grant comes out, whether they're capable of doing it, whether they're interested in doing it. So I must say we've not been taking a very strategic approach to this. Likewise with public health as well as clinical. The limitation, and I think the elephant in the room is our inability to really work together with our colleagues in Ministry of Health to do something much more at a national level, which is quite sad in a way, because although we were the only hospital that were designated outside of KKM as a COVID-19 hospital, even at the height of the outbreak, we only total saw 150 patients. So in terms of clinical research that's directly related to COVID, it's quite limited. But as you said, Prof. Effendi, there are many other, and Prof. Shaiful, you gave great examples of COVID-related research, whether it's in medical education or how the pandemic has affected other diseases. But in terms of rushing out to kind of apply for those international grants, we haven't done much apart from one with Oxford on vaccine trial. But yeah, so the answer is not really.
Thank you, Prof. Dato' Adiba. So we move on to the conduct of research. The impact of the pandemic will be felt in the coming years. Yeah, so as you know that the global recession is taking place in most countries, including Malaysia. So eventually, the budget for the COVID-related or non-COVID-related will be affected. So how do you sustain the momentum of research in your university in a limited budget? Can I get Prof. Shah first to give comment on this?
Okay, rather difficult question, isn't it? I mean, in the sense that the pandemic will have an impact on two aspects as far as research is concerned. The first thing is on finances. Being a private university, I think we are completely dependent on student income and student numbers, and when that gets reduced, we get into trouble. International students are another big source of students, and they are going to be significantly affected over the next couple of years. So it is especially affects private universities. But though I suspect public universities are also going to be affected because it's having an impact on government finances. But so what do we do when we have that, you see? I mean, what we have tried to do is try to continue the focus on our current areas. Second thing is that we try to build capacity while everybody is sitting at home, and we find that we have, it's a good time to build research capacity, to go and get grants, grant writing workshops and proposal writing workshops, statistics and analysis workshops and all these kind of things for young people. And this can be done exactly like how you are doing it here, Prof. Nofiza, so it can be done from somebody who is in overseas giving a session and giving feedback. So that is one thing that we have done. We also have found that though the student numbers have been affected a bit, but not as much as we initially suspected, you see. I don't know about other private universities, but it has had a slight impact, but not a lot. And as a result, we find that we actually have saved a bit of money. And this is because staff is not going overseas. They are not going for conferences. They're not going for this. They're not going for that, and all these kind of things. And as a result, there's some money which has been sort of currently, which was budgeted for those sort of things, are not being used. So we have actually decided to take that money and put it as seed funding. We actually have higher seed funding this year than other years because of this sort of slight savings we have had. You see, we have given about almost 250,000 as seed fundings to our staff. Small amount, 5,000-10,000 kind of things, and mainly those funding is primarily aimed at people who have got a project which can result in subsequent programs, which can result in another funding round internationally. That means it's a pilot kind of a project which will then help you to apply for overseas funding later on when things open up. So that's what we have been doing. Limited budget, but there are savings in some areas, and those areas we have sort of re-pushed it into the research thing. But we expect that those things are going to be very difficult over the coming years. So we have to build the capacity of young people coming in and taking on these projects and developing capacity and putting up more and more projects out there. We cannot 100% depend on the very senior, as Prof. Zambri said, about senior people who have got a very strong record of getting funding. I think some of them cannot continue to do that. They have to get young people to mentor them and make sure that they get into the game as well. Thank you.
Thank you, Prof. Shahjahan. Can I get Prof. Zambri? Because I know that your research is more on laboratory-related research that require quite substantial amount of money. So you want to comment on how you want to sustain the momentum of research, especially the laboratory-based research?
Yeah, we were worried about this pandemic in terms of fundings and so on. But it seems now that it's not a problem because we have been getting grants now coming in, PRJS, and a lot of good news that our colleagues have been acquiring grants nationally, as well as industrial grants and international grants. So at the moment we are still doing okay. Probably that will last us for another, depends on the grant, 1 year, 2 years, or 3 years. So it seems that in that sense we may not be that affected. But of course, later on we have yet to see the budget from at national level. Probably there's a reduction in budget. And we'll see whether the FRGS, which will be announced this month, we hope. I was also applying for it. So we hope that maybe we can get more grants. So if, let's say, there are enough fundings, maintained as maybe the same as previous years, there should not be any problem in maintaining the momentum. It's just that maybe to get international students to the research will be a bit problem, though we actually get a lot of applications internationally for them to apply, but it seems that they cannot get into Malaysia at the moment. We hope that the borders will be open. And your question on whether my research basically is laboratory based and requires a lot of money, yes, definitely. So we need to strategize. We should not look at just national grants. We need to look for collaborators, especially international collaborators. So that is ongoing, and there are lots of strategies at department level. We have already informed them that we should not go nationally now. Everything should be international.
All right. Thank you, Prof. Zambri. What about USM? Prof. Saiful, do you have any plan to maintain the research energy in your School of Medicine?
Right. Thanks, Prof. Well, to be honest, I think there are a lot of positive things comes out from this pandemic, COVID-19. In terms of momentum, I don't think we actually we actually doing well. I mean, except for maybe the first 2 months during MCO, where we stopped most of the things. But otherwise, we continuing now. We are doing almost near normal sort of research project, and we can see that a lot of impact. For example, we have more publications now, including, more than, more papers coming for the COVID-19 related papers, and more publication as well, other publication as well. And this partly maybe because, work from home, where people said that, many more time, they have more time. In fact, I have one academic staff who said that she managed to prepare 20 manuscripts throughout, the last couple of months, which is actually a very good thing, just to translate in terms of what the impact of research. And so basically, there's and as mentioned also, the budget. I don't think we have at the moment. We don't really feel, we have a limited budget. I think we have a lot of grants. We still do have money to actually proceed with our research. But of course, to maintain, to sustain, we probably need to improve in terms of our collaboration, as mentioned, especially international collaborations, So we still need to do that, So the other things that I think also positive thing that came out from this is actually in terms of expedited process of research, research proposal, research grant, and then and the whole process as well. For example, our ethics committee now meet every other week, for example, and they approve expedited reviews, and they now 100% online, so application and so on and so forth. So there are a lot of positive things that will help for us to actually sustain or even improve the momentum of our research. Thank you.
Thank you, Prof. Saiful. Can I get Prof. Effendi again to give comment on this issue? You know that these scientists and researchers, some of them are unprepared to start their research following post-pandemic, There are quite a number of challenges that the researchers are facing, especially studies that are about to finish, like clinical trial and all that. So how do you tackle the disruption in, for instance, data collection, like because of the suspension of the enrollment, and then you've got a very limited space in the lab, so physical distancing has to be there, and clinical trial, recruitment of all the vulnerable subjects. So can I invite Prof. Effendi to comment on this?
Thank you, Prof. Nafiza. A very important and relevant question during this pandemic. I think what COVID-19 taught us is every sector is a health sector. Whether you're in the lab, whether you're in the community or hotel, supermarket, I think we have to practice all these SOPs to prevent further transmission, infection, and what we call this applying physical or social distancing, things like that. For clinical trial point of view, I think this is an abrupt, complete cessation from February, maybe until June or July. So a lot of clinical trialists has I so-called maybe hibernate during that period of time, and sudden cessation of the recruitment of the patient. And of course, these are the patient or the participant, the healthy individuals who are regularly coming to the clinical trial system for recruitment, for review, for sign the consent, so and so. So I think we have not witnessed this event before. And I think in the process of getting what are the best practice to be done, which is not really now, engaging with the sponsors, with the clinical trial sponsors, with the committee members who are involved with this, how we can do remote or distance style of practicing clinical trial using the telemedicine or telehealth, e-sign the signatures or e-consent, then e-assessment of the patient, and reporting into the, for example, in the electronic record form or database for the patient. However, we have to be very cautious in this because I think the Institutional Review Board of Ethical has maybe no guidelines how we modify this standard of clinical research in the arena of clinical trial, for example, and this could be a minor deviation of the protocol that we actually have to report to the sponsors. And I think we are still learning, and we have to really identify, we really have to use maybe in the future not in the hospital ground anymore to avoid the congested hospital, maybe a mobile clinic for specifically for focus clinical trial to recruit the healthy controls or the patients who are on these various medication. And it is easy to say, and of course it costs a lot of money, but for some clinical trial involving intervention, for example, has to do assessment for endoscopy. Like it or not, at this moment of time, the patient has to really adhere to the schedule that's been given to them in order for the clinical trial to pursue. And those who are not, well, they are automatically deviated from the protocol, though they are so-called to now is a minor protocol deviation. But I think these are the issue that we have to come out maybe among the best practice guideline for clinical trial that we conducted in Malaysia, for example, or all over the world, and how we can collaborate actively, aggressively with Ministry of Higher Education, MOSTI, and in fact Ministry of Finance as well, because it involves another extra budget. And we also have to address the financial assistance or more money from the sponsors or clinical trial organizers for us in order to carry on all the clinical trials, not only now, but also in the future when the COVID-19 is finished.
Thank you, Prof. Effendi. Can I invite Prof. Saiful? I know the nature of your work is mainly, majority of it is field work. Do you facing the same difficulties in conducting your research post-pandemic?
As I mentioned just now, except for the first 2 months of our MCO, I think the rest we are doing actually fine now. We are continuing our field work, but of course we also develop guidelines. You know, we have guidelines for those who are going to the community. In fact, those who are doing clinical trials as well. You know, and those who are going. So we develop guidelines so that they have to adhere to the guidelines. Otherwise, basically now we are almost, I would say that full-blown continuing our clinical, our studies, our research. Yes.
What about Prof. Zamri? How are you going to ensure that all your researchers are working in a safe environment? Want to
of course, we have our SOPs, especially in the lab, that we have to maintain physical distancing and very strict and hygiene, things like that. So these are being led out by the university, and also we have officer to actually monitor these activities. So Alhamdulillah, at the moment we don't have any problem complying to the SOPs. So that's it.
All right, thank you, Prof. The final theme is on the digital health technology. I think this is a very important topic. So in dealing with the pandemic and the reality of physical distancing, it's actually forced people to use the digital tools, to stay connected and to stay productive. So clinical trial, for instance, is affected as we have to minimize the face-to-face session with the vulnerable population. So in your opinion, to what extent we should focus on this technology in order to do what is called as an action at distance? Can I get Prof. Shah to comment on this?
Okay. Yes, I think, late last year, we actually decided that we want to go into digital health and digital technology in a sort of a big way. It is one of those sort of areas which can naturally falls under multi-faculties. It's medicine, School of IT, School of Engineering, and all these people naturally will come together or should come together. You can't run it in one single department or one single faculty. So we did decide, and we actually put in a fairly substantial sort of plans for this year to do that. And of course, everything was very nicely done. We had planned everything very well. And then next thing, everything locked up. Now we got locked up already, So everything has been delayed. unfortunately. But the fact is that digital health, because it had started, we have actually a strong push towards it. We have got something like about 20 projects, which are significant projects, which have been already started, not started, which have been proposed, and grants have been written, but we haven't got any funds yet. We haven't put anything out yet. So the areas we are looking at is very much things like apps, but not. When we initially started, it was nothing to do with COVID, of course. It was digital apps to assess people's gait for Parkinsonisms, or frailty for people who are sort of prone to falls, or dementia, assessing dementia as progress using digital technology, phones and all that. And so we have developed or started developing apps which will allow that. I mean, these days it's not that difficult to do. Of course, the problem is you can develop the apps, but to test it and then to see whether it actually makes a difference in the patient's life, in assessing progression of dementia, for example, or something requires you to go out there in a community and actually test it. While there has been proposals, and while we'll be happy to collaborate with anybody else who may be interested, we haven't gone there yet. But I think there has been a strong push towards digital technology. There's also been a strong push towards digital technology in education as well, so in the sense that we now have apps, students able to the student, individual student, so that they know where to go, where it's happening, and any changes. And also the learning outcomes are there, the slides are there, the things are there, everything is in the timetable, everything goes in, and any changes in the timetable automatically gets updated as well, and attendance is also taken at the same time. So those are with education we have started doing that, and that seems to be working, because that had started before the COVID. But since the COVID, we haven't been able to test any of these things which we have sort of started developing, and see whether it actually works. And especially in relation to clinical trials, which is where ultimately you need to test whether it's going to have an impact on the outcome of anything, because digital technologies are very good at assessing at a single point in time, but perhaps accurately, but how reliable it is, and then 6 months later, if there is a change, is the change significant? Those kind of things hasn't yet been done, but we are very keen on getting involved in that.
Oh, great to know that Monash are already embarked into digital health. What about Prof. Dato' Adiba, you want to comment on involvement in digital health technology?
Yeah, so like Monash, we kind of got together a group of clinicians as well as colleagues from computer science, and we had one or two colleagues from law as well, and formed what's known as the eHealth group that started more than a year ago now. So this was actually fortunate, because when COVID came, the team quickly sat together, and that's how we came up with Cosmos. Within, I think, 3 weeks, they came up with the app for patient monitoring. So yes, to say that we are going into digital health in a big way would be correct. From looking at how we could align the EMRs to patient registry, so that we can data mine for not just for research, but also for quality improvement purposes. So that is currently being worked on, to have cancer registries. We actually developed a COVID registry that was linked to the EMR as well, using RedCap. So from from a EMR patient management point of view, we're working very hard together with the hospital to kind of make it easier for researchers to access patient data. Of course, there are issues around PDPA and all that's currently being sorted. So there's a concerted effort towards that. The other is, of course, telemedicine. We're just taking baby steps with telemedicine, again, because of the concerns around confidentiality, PDPA, etc., etc. The other area, and I think again Shaiful and others touched on, is in terms of student learning. So we view digital health not just for patient care, but in all of the three missions that we all have to undertake: service delivery, health service delivery, education, as well as research. So we're trying to align all those three as much as possible within this eHealth group, which hopefully one day we want to create a digital health unit within the faculty and the hospital. So yes, we're putting a lot of thoughts and hoping to get funding for this. Not that we've been very successful in really pushing digital health at the faculty.
Thank you, Prof. Adiba. Can I get Prof. Saiful to comment on this? What about in USM? Are you going to incorporate digital technology into research, for instance, family care?
Well, not so specific. Basically, we do not have a specific plan at the moment. Of course, development of apps, converting from the questionnaire into apps and so on. So, I mean, that is ongoing, but nothing specific. But we are actually now, as Prof. Adiba said, that we are also empowering or enhancing our teaching and learning methods, and also especially assessment, looking at the security and so on and so forth. So that is basically the technology in general. Yeah. So nothing big from USM, probably, Prof.
All right, thank you.
Prof. Hafiza, can I just interrupt there for 2 seconds, just because I've got all the deans here. This is more to do with, since Prof. Shaiful mentioned assessment, Prof. April from surgery has developed this basic surgical training program, and the assessment is all online, and working with Academy of Medicine to develop this program. So taking on from that, we are developing a much more, hopefully, comprehensive and sophisticated program using Microsoft Teams for all the assessments that's going to be required in the master's program / national curriculum. At the moment, we're just mapping it out. So hopefully this will be shared with all the universities, and you all will naturally be invited to be part of it. But right now we are just doing the mapping and working with people from Microsoft, because that's why I asked the deans the other day if you all have access to Microsoft 365. And the aim is that all our masters trainees will have e-portfolios, and the assessment and all that will be on a Microsoft platform. This is obviously going to take a while, but please bear with us for the moment whilst we do this. Yeah, not doing it as research, but doing it as part of the masters, Penambah Baikkan Masters program.
All right, thank you, Prof. Adiba. Lastly, I think Prof. Effendi, do you want to comment on the use of digital health technology?
Thank you, Prof. Hafiza. I think digital health technology is the way forward for many institutions, not only focusing on the research aspect, education, assessment, so and so. And we do not have an electronic medical record yet in our hospital, but the total hospital information system is in progress. I think by early next year should be start doing that, and there will be a pilot program, two departments for the telemedicine, Department of Medicine and Psychiatry in the hospital soon to test for the telemedicine. But I think digital health is, nowadays we are still learning, but I think for the futures, maybe 30, 40, 50 years, it become normal physiological process. For example, in the arena of clinical trials, that, as you mentioned earlier on, at distance or clinical research at distance, it's a new norm of conducting clinical research trial. For example, of course, this to minimize the face-to-face contact, avoiding healthy control of patients in the congested hospital, or even to prevent them using public transportation. And I think we as researchers must be proactive, persistent, adaptable, and also assist our patient for clinical trial to run very smoothly. And of course, engagement with the sponsors using various platforms so that clinical trial can be run very smoothly for e-assessment, e-sign, e-consent, many e-things, so that can become a norm for the future. And I think it remains to be seen with the Institutional Review Board of Ethical to handle this new norm at the practice. And I think it's the best time to have this forum so that we can share the ideas, approaches, so that we can come out with the best practice or some kind of solution. Let's say 50 years time, COVID-2080 coming. So we have a ready-made mechanism already how to do that. And I think one thing that I learned involving in clinical trial for the last couple of months, social distancing, but this is maybe a social isolation or social suppression with the subject we also need to consider. Because I think the antidote for the social distancing is really human connection. We rarely have to do with teleconference or telemedicine, enrolling or using our support nurse or clinical nurse, a clinical support assistant to get in touch with the patients, with vulnerables, like say elderly patients or people who get chronic diseases who cannot afford or cannot come to the hospital for this COVID-19. So I think this action at distance, as you mentioned, will become a norm. I will not call a new norm, maybe the next norm or another next norm for the future. So I think we have to get ready, we have to be proactive, and we will ready to be changed. If not, we all be changed. And I think let us change the crisis of the COVID to the opportunity, change this crisis to opportunity that we can do plenty things together with many other institutions, either public or private, for the betterment of our country. That's my last comment. Thank you.
Thank you, Prof. Fendi. I think that's the end of the forum. I would like to congratulate and thank you for everybody to joining me for your views and comments on the issues related to research. And I agree with Prof. Fendi that we should come together to address the challenges facing due to any kind of pandemic. So I think if the Kementerian Pengajian Tinggi, if they could hear your views or your challenges in facing all the issues that we have been discussed just now, we have to admit that there are no single national guideline for the biomedical researchers to even adjust or adapt or even adopt in performing either clinical trial, community-based or laboratory-based research in a safe environment. And with that, I thank you.
Thank you very much.
Thank you so much.
Thank you.
Thank you.
Thank you, everyone. Bye.
Thank
Bye-bye.
you. Thank you so much.
Bye.
Assalamualaikum.
Islam.